What's up, everybody? Welcome to What's the Lesson podcast. We back in the classroom. Today I have Dr. Lindsay Weisner back on. Today we're gonna talk about trauma, trauma bonding, and all different types of trauma. It's a really dope episode. I think you're really gonna enjoy this. Before we get started, make sure you get your tickets for the Von Michael Sketch Show at vonmichael.com/sketch show. All right, y'all. Let's get into this episode. Enjoy.
Thank you so much for joining me. I guess I'm gonna just get straight to it. What is trauma?
So trauma is a something from your past that continues to affect your thoughts, feelings, or actions in your future. Trauma also has a. I was trying to decide, like, do I flesh that out or go a different way? But I'll get back to it. Trauma. There's also a biological basis of trauma, which I find to be really important, which is that our bodies, our brains are trained to remember dangerous things so that we don't encounter them again. For example, if you see a lion and it rips off one of your arms, your body and brain are trained to vividly remember that lion so that hopefully you manage to keep the other arm. What do I mean? Well, we all understand a lion ripping off our arm, although hopefully not many of us have experienced this personally. But so when you are frightened, your stress hormone cortisol gets released, and then cortisol kind of shifts into or kicks your fear memory in. Now, fear memory is kind of exactly what it sounds like. Your adrenaline goes up, your and your senses are heightened. The adrenaline goes up just in case you need to either fight or run away. But the adrenaline going up also means that you're paying more attention to this thing in front of you. Your senses are heightened, so you're more likely to remember this thing, in this case, a lion, more. And it imprints onto your brain in a way that allows you to go, nope, the next time you see a lion and walk away. Or run away, or I am actually not clear how we're supposed to avoid lions, but nonetheless, there's a way. And the idea being this allows us to avoid trauma a second time. This allows us to avoid, losing our other arm. The only problem is that our bodies are imperfect, and what was put in place to protect us can outstay its welcome. You're there may not be a real danger of a lion, but perhaps if you experience this rather unlikely event of a lion ripping off your arm, unless Tiger King, but that's another issue. But if you experience that, that's fine. But your body may start um, to release this cortisol and send you into a trauma or traumatic state, like a PTSD, if you see a stuffed animal lion, or if there's a lion on the television, or something that is not actually dangerous but feels dangerous as a result of your past experiences. So trauma is kind of when the past comes back to kick you in the ass, but there's a real reason for it, and the intent is to warn you so that it doesn't happen again. The problem with that is we end up dealing with PTSD, whether it be, as a result of being a soldier in a war, or an abusive, emotionally, physically, sexually, or mentally abusive childhood. The problem is trauma is very difficult to overcome, and part of getting through it is to literally go through it and sort of revisit it, re-experience it, explore it, and find that it's safe. And no one wants to be made to feel unsafe or icky. And yet that is what therapy does when we try to rid ourselves of trauma in the long term.
Wow. Okay. So are you saying that trauma only have a negative impact on your life?
That's an interesting question, and I don't know quite how to answer it. I think by definition, a traumatic experience is a negative one, but there are people that have turned this negative experience into a more positive one. You know, if you, Captain America in Avengers 2, you know, he has all this trauma from, not Avengers 2, in the last one. I'm blanking. Don't tell my children, they'll be embarrassed. What was it called? Endgame. Thank you. So in Endgame, Captain America comes back from, you know, losing a very bad war, losing a lot of friends, and he makes a little support group, like an AA group, but for trauma. And so he's using his trauma in order to, I'm going to say, act as a vessel in helping others. So that's kind of a positive. You know, or someone who creates some sort of a club or an online forum or some way to reach out to other people who are experiencing or have experienced what they went through, you know. Or trauma you can also turn your traumatic experience into something creative. A lot of the times when I write, both fiction and nonfiction often come from some of my previous trauma. So that's a good thing. It's called sublimate. So it basically just means transform. But if you can transform your bad shit into good shit, then yes, I guess it's a good thing. But I would never wish for someone to be traumatized for that reason.
Gotcha. Okay. Yeah, I feel like a lot of people, especially in arts, music, comedy,
Totally.
definitely.
Yeah. Oh, we're the most messed up people. You know, comedians.
Americans.
I was going with comedians, you know, artists. Like, we've just found a way to make the bad stuff funny. And I see that about you a lot.
Yeah, it's funny. That's why I actually got into comedy. I saw Kevin Hart. I was like, if he could talk about having a father who was had an addiction to crack, I was like, man, like I could only experience. Like, it's so funny, but it's just like, do you actually know what he had to deal with to go through something like that? I'm just like,
yeah.
I was like, if he can make that funny, like, this is therapy. That's what I'm in comedy for therapy. I'm not even comedy like for the jokes.
I understand. My writing, like a lot of my writing is for therapy. You know, there's also Jim Norton, and he, you know,
oh yeah,
you know, deeply depressed, super suicidal in the past. I you know, I interviewed him, I don't know, 8 months ago, but he makes it funny too. And it is the way to laugh at yourself when you really want to cry.
right. And you kind of already went over some of the ways to cope with it. Are there any other options? Say someone is on their own. Well, let me ask this: do you suggest anybody to? Would you automatically, if you got trauma, just go to therapy, or is there ways that you can find ways to cope on your own outside of, you know, through the arts and stuff like that?
So in an ideal world, if you experience trauma, you should absolutely go to therapy. But let's get out of that ideal world and talk about the real world, where trauma comes with such guilt and shame. You know, whether it be sexual abuse, which is, I guess, shame, and guilt, especially if you're a young child. That, you know, you tend to, especially young men, they tend to think that they did something wrong. Young women as well, especially if the abuser is sort of puts that guilt and blame and whatnot on them, which is horrendous, but so first you would have to get through the guilt and the shame in order to be willing to come to therapy. Can someone will themselves out of like a PTSD without the help of a therapist? I don't know, but I kind of don't think that they should have to try. Rodney Dangerfield was, I hope I haven't told you this story, but even if I had, I'm telling it again, because he was in therapy for years and he was getting nowhere. Do you remember who Rodney Dangerfield is, or are you?
Yeah, very funny comedian.
Okay, I was gonna say you might be just too young, but so he was he was in therapy for years, and then essentially finally he kept failing, and finally his therapist was like, maybe this just isn't the right field for you. And fortunately he left his therapist. I think there's some trauma there about your therapist telling you to give up your dreams in and of itself. So
wow.
Isn't that a great story? I learned it in like as part of my training. He was in like 3 times a week therapy, and it was like a story that had been passed down, from one person to the other. And it totally breaks all of HIPAA, but it wasn't my patient, and it wasn't the person who told me the patient. So, but I think it's a great story where like it's a lesson to therapists where like, don't think you have all the answers. And also it's a lesson to comedians, like keep trying. And then there's the trauma aspect, which is he also was pretty messed up. And I think it's tough to find a comedian who wasn't messed up in some way. I kind of know a few, but but still, I think that we're all messed up in our own ways, and it's really what we make of it,
Right. I was going to ask you next. So, are there signs of trauma? Say that you have a family member, friend. Is there ways that you can tell that somebody has had a traumatic experience just by talking to them, or?
Sure. Listen, if you know someone who was just involved in a car accident or some sort of public issue like that, one that involves less shame is what I was thinking of. You'll soon notice, if they're acting differently afterwards, either avoidance or overindulgence in, alcohol or drugs or any sort of extreme changes to their mood or behavior following a known traumatic event. That's certainly an easy sign to look for. And then more often than I think you don't know it's the traumas that people don't know that is more. Listen, if someone returns from war, active duty, whatever the right army thingy is to call it, like if you're close to them, be on the lookout for them. But also, the other side of it is a lot of our traumas are secrets. Rape, robbery. I guess robbery isn't so much a secret because we usually report it, but on a very minimal level, like I was scammed about 3 months ago during the pandemic. I was scammed out of $1,200, and it's kind of because I'm an idiot, I'll be honest. But now I'm a lot more hesitant when I'm dealing with people online, and like I kind of require proof of everything. Is that trauma? Sure. Has it maybe made me less of an idiot? Hopefully, it's not interfering with my daily functioning. So it's not something that I need to specifically seek help for.
Gotcha. So, okay. So you say you're more hesitant. Will we call that the red flags?
Mm,
What are you looking for?
I don't even know if it's a red flag, maybe an orange flag, but like, like a red flag that you're looking for is, first of all, if you know, a red flag is a significant change in behavior. Someone who withdraws more or engages in more, like I said, alcohol or drug consumption, someone who really starts acting differently. And whether or not, the issue is you may or may not know what actually happened. And, or if you do know, then it's a lot easier. But childhood trauma, we all hold super close to the vest because we were told consciously or unconsciously that we should not tell, that what goes on at home is secret. That's sort of an ongoing theme that many victims of a childhood or, even a teen year trauma go through. Also, as women, I want to say in the United States, it's probably all over the world, but whatever. As women, whenever I ask a female patient, do you have any history of trauma? Their answer, and then I'll sort of break it down into physical, emotional, sexual. The emotional and the sexual are the ones where they don't always know the answer. Or they know the answer, but they feel guilty defining, an experience they went through in that way. Whereas a man will tell you point blank, like yes or no. And so it can be really tough to get people to speak about their trauma, and also to get people to admit it. When it comes to sexual assault or abuse, there is a blame game going on.
Gotcha. And did we already go over things that may cause trauma? I feel like we already talked about that.
I feel like I've mentioned a few things, but I mean, the truth is anything unexpected could cause trauma.
Okay.
Anything repeated could cause trauma. All right, I guess that's a really bad definition. Don't do the repeated thing. But like basically, there's a couple obvious ones like war, violence, rape, murder, anything that would be covered in a true crime documentary. We can pretty much label that. But you can also experience smaller traumas, or what starts off as anxiety and ends up being classified as a trauma, but you can experience smaller ones from, like, even an experience in this pandemic can cause a trauma. It's not one that's impossible to get over, but it's certainly one that may stick with you.
Yeah. Then I want to go ask one question, then go into relationships. So I know in the world that I'm in, the community where a lot of people like to do roast,
yeah,
and stuff like that. Would you say maybe like roasting someone unexpectedly could be traumatic with somebody?
I have seen roasts, and I feel like if you're getting up there to, if you're a willing participant, like it's not going to be unexpected. And I feel like you got like professional, semi-professional, whatever. You're getting on that stage for a roast. I don't think anything anyone says is going to traumatize you. And I would be really pissed off if we started giving like trigger alerts before roasts.
No, I mean, more of the aspect of like I've seen people like have done roast unexpectedly. Like it's almost like such and such did something, we're going to roast that person um, without their knowledge.
But is
Like,
this like in the comedy world?
yeah.
Meh. I mean, if you've seen it, you kind of know it's coming. Listen, it's always possible that we could somehow say something that triggers, hate that word, another person. But, I hate it because it should only be used in a very finite amount of situations. But yeah, it's possible we could say something that would trigger another person, but it's you can't live your life afraid of that. Afraid of triggering someone. The truth is, if it's your trauma, you should be seeking help for it. And if you find yourself getting triggered in a roast, then you should figure out what to do to stop it from happening again, which is, you can fill in the blank. What is it? Seeking help. Yes.
No, I want to make sure I'm clear because
yeah.
So I give you the example, and I'll tell you why. Because I thought about it, I was like, man, I thought about it, I was like, I didn't want to participate in this because I felt like it could be cruel and kind of traumatic to somebody.
Sure.
So like there was a show, like you've been to like a normal comedy show, right?
Back when there was normal, yes.
Yeah. So it was brought to me that we're going to roast another comedian, but the comedian did not know that there was going to be a roast.
Okay.
And I spoke to someone about it, and it was like, you shouldn't roast somebody because no one just signs up for a roast. That's like picking on somebody or bullying them. And I've seen somebody go through that, and they were like not the same afterwards.
Really?
Yeah, because they weren't expecting the roast. It was just kind of like out of the blue, like they popped up, and then everybody was just kind of talking about them. Like it wasn't set up as like there's a difference between like a roast show and like, all right, we're roasting each other. But this person was just like showed up to the comedy show, and then everybody was just roasting them on stage.
I think this person might need help, and I say this not in any joking manner. Like, I mean, I don't know how bad it got, obviously, but like, I definitely feel like I interviewed a comedian. Her first name is it's Ariel Ilias, and she I tried to pronounce her name correctly because she's Israeli, and so it's not Ariel, it's Ariel. But I don't have that accent. In prepping for my interview with her, I was like YouTubing and Googling, how I go back as whatever and do my research. And I saw a roast between her and this woman that was her very good friend. And like, I would have cried, it was a lot, but I also felt like if you're getting on the stage, you kind of know what's coming, maybe not. But I mean, if you're in the comedy scene, I guess, don't you know that this is a possibility?
No, it's not like I could tell you a lot of comedians don't do roast. Like it's one of the popular things, but there's a lot of comedians who only go do their jokes and that's it.
Okay.
And because roasting is a skill in itself. Like that, to me, that's separate than actually like telling a joke or a setup punchline. Like there's people that's really good at roast, but they're not necessarily good at stand-up comedy.
Okay.
So it's a different skill. So yeah, I wouldn't consider it as part of like the norm. And I don't know. I just saw it and someone brought it to my attention because it was part of the normal for the community. But somebody brought it to my attention, was like, "Oh, you shouldn't do that." And I never looked at it from that perspective before. That's why I was asking you.
Right. Yeah, I guess it's possible. But if that's the case, my guess is that the person's response is based on something deeper and not just, not just what happened at the roast. Like, I don't think an average person would, usually if something affects us deeply and differently, it's because of something from our past.
Gotcha. And I think that's a perfect segue into how can trauma affect your relationships?
Oh, sure. People deal with, it's not unusual for you to end up in a relationship. I'm thinking romantic, obviously it could be friendships as well, but you to end up in a relationship with someone that that you chose in some way to heal from your trauma, or your subconscious screwed you and you chose to be with someone who on some level repeats your trauma, if not through physical abuse, maybe emotional abuse or psychological abuse. The other way is some people will choose partners that are nothing like the parent who traumatized them or the individual who, traumatized them. Women who have been, I should say girls / teens or whatnot, if a young girl is sexually abused and it's not attended to, through therapy, it's not unusual for the young girl to either become promiscuous, which is like just an attempt to own her sexuality so that no one else gets to decide for her. Or on the other end of the spectrum, she could in fact become very shy, take to covering up her body, not wanting anyone to look at her, to see her, as an attempt to hide, and to undo the wrong that was done to her, sort of blaming herself. So trauma, from your past may still be affecting your relationships in your present. And unfortunately, if you let it, trauma can really define your life.
Wow. Okay. And you said that, so you can be attracted to someone who traumatized you, or you may be dating that same person that has traumatized you in your childhood or your past before. Is that correct?
Someone similar, I said.
Okay.
Yeah.
So, because I've heard this before, is that why, I've seen this a lot with dating. People tend to date certain people, and it's always like a failed relationship. That has a lot. I've heard that. So, what should you do if this is something? Can you retrain yourself to? I don't know if that's the right word to use, but can you get over this and so that you can start dating better people?
Sure. I mean, I honestly think most of us tend to date the same assholes, but in different bodies, and there's always a common thread to the people we choose. And I do think often the common thread is related back to your childhood. And if you had a more positive childhood, fantastic. And if you did not, that's where the problems come in. And you may tend to date someone who is similar to, the traumatic or more negatively affecting parent, or you may choose the opposite, which sounds like it's more positive, but it also could put you in the place of taking on subconsciously, unknowingly taking on the characteristics of the negative parent, the abusive parent, so that because in a sense that can make you feel like more powerful, or we would call it like you're gaining a sense of mastery over how to get past what happened to you in your childhood.
Gotcha. Okay. And my next question for you is that what is trauma bonding?
Right. I had to look this up. I know this as something different, which trauma bonding is another word for what we usually would call like Stockholm syndrome. Stockholm syndrome being many, many years ago, there was a kidnapping in Stockholm, and or maybe that was the guy's name. I'm blanking on the details, but basically, by the time the individual, the kidnappee was rescued, she had fallen in love with her captors, and I guess similarly, or perhaps this is just a more modern word for it, this trauma bonding. Um, I I have an issue in broadening it because um, part of me feels like that shifts some of the blame to the victim rather than to the aggressor. But then again, if you followed the Jerry Sandusky Penn State case at all, the confusion of that criminal trial and the civil trial and all that was in part because these same boys who were sexually abused had also developed a separate emotional attachment, and therefore were very confused as to what was right, what was wrong, what they experienced, what they witnessed. I mean, I think that's probably a good example of trauma bonding, where the abuser plays a role with many hats, you know. I guess a less popular way to explore it would be in the case of, like, you know, female teacher seduces male student, and then our brains go crazy because we have a hard time imagining that a horny 15-year-old didn't want it, but a horny 15-year-old isn't equipped to deal with the physical and emotional demands of, you know, a 30-year-old adult woman. So I could see trauma bonding occurring there as well, because there's so much conflict with what he's supposed to want, what he does want, you know, sexual versus emotional. Trauma can be confusing, you know, and it's meant to be. You know, when you think about like PTSD when it comes to war, it's sort of a lot simpler, like not to get through, but just to understand in your mind. You know, you went through something really bad, and now every time you hear a large sound, you're worried something really bad is coming again. Once you get people to stop saying, but you're not there anymore, which is annoying, you can move past that, and people can sort of understand, oh yeah, something really bad happened. You're worried it's going to happen again. There's no trauma bonding when it comes to, you know, like a former soldier who saw horrible things and is now home. They're not going to fall in love with their, you know, I'm worried I'm going to say the wrong word and it's going to be like a yeast infection and not a bomb. So I don't want to say it, but you know, there's no chance of them having trauma bonding with a weapon or the enemy who fired the weapon. But when it comes to more interpersonal instances of trauma and how it affects us afterward, it certainly gets more complicated.
Gotcha. All right. And I guess my last question is I feel like you might have hit on already. What are the emotions that you may be going through when experiencing trauma?
God, fear, anger, frustration, resentment, any emotion that you suddenly find that you're experiencing to an extreme. Avoidance, you know, if there was a car accident or you got mugged on a certain street. Self-blame, the list goes on and on. It's really about a disproportionate reaction to the current situation based on something you went through in the past.
Gotcha. And you said if you're experiencing this, the best thing you should do is to seek help.
Yep. Seek help. Yeah. And if you're not willing to do that yet, you know, TikTok's got some woman who's constantly, a few women are constantly giving advice, and some of them are psychologists, and they'll give you like a bite-sized morsel of brilliance, and then you're like, oh, that's right. But bites don't fill us up forever. You know, they're short-lived gratification. But if you need to stick your toe in it somewhere, you know, you can look online and find, you know, some sort of therapist talking about trauma and whatever. And but eventually you're probably going to need to take the plunge and work through this with a trained professional.
Wow, I never thought about that. Okay, so you really do need to. It's so funny you say that.
Yeah, I know. We all get our stuff from, I mean, I don't, I'm too old for TikTok, but the rest of you get your shit from TikTok. My patients will send me this, they're like, look, this is brilliant. I'm like, that is brilliant. I said that 3 weeks ago, but my you didn't look as pretty, and so you didn't listen. Yeah.
I told you, like, I think this is. I think my therapist gets paid a lot because she actually encourages me to quit therapy and just watch YouTube videos.
Really? Like, that's not what she says. You're not listening to her. That's not what she does. You're definitely not listening to her. I would never encourage someone to quit therapy and watch YouTube videos. I mean, fine, watch YouTube videos and like watch TikTok shit, but like, or Instagram, but like the truth is, that's just someone making general statements that it's sort of like when, you know, John Edwards is a psychic and he used to have the show where he'd be like, I'm sensing someone in this room lost a relative. Their first name starts with an S, you know, and like 80 people would be like, and then he would be like, no, hold on. Was it Sam? Like starts throwing, you know, and the whole room went crazy. And eventually it hit someone in the right way. And like everyone's like, you know, hallelujah, it's a church now or something. So
yeah, that's like, you ever watch that show called Psych?
Yeah, totally. Love that show. Yeah.
Well, that's probably like my favorite show. And like, it's so funny that and in a way it shows like this is not real, but it's just so funny.
Right. It's often just logical deductions. I mean, I'll be sitting there with a patient and I'll get like this you know, psychic premonition. It's not a psychic premonition. It's my experience that is, you know, coming together in a way that although consciously I can't put it into pieces, subconsciously I'm like, this is so like so and so. This person has been abused, you know, or something. And we need that experience of a professional to get us to a better place. But fine, play on TikTok all you want.
So other than that, I feel like we went over all the questions I had. Did you have anything to promote or anything to add at all?
No, I mean, I think we've made it pretty clear. Trauma is bad and you should seek help, and it can come in any shape or form. And if you feel ashamed or guilty or blamed or whatnot, please know that you're not alone. That's why, you know, that's why our culture, that's one of the many reasons our culture is flawed, in that we still engage consciously or unconsciously in victim blaming. And so, you know,
is it victim blaming?
Victim blaming, like blaming the victim, you know. Mm-hmm. So that makes sense that if society is telling us it's our fault, eventually we're going to believe it and be like, yep, this is my fault. And the truth is, it's probably not. You know, if you walk down a dark alley and you get raped or mugged, okay, shouldn't have walked down that back alley, but you didn't agree to be raped or mugged. And if you drank too much at a party, you didn't agree to whatever consequences come next. I think you need to give yourself a little space to accept that this wasn't your fault. And when you can't do
Gotcha.
that, you go to therapy.
Okay. Yeah. I think I'm gonna name this episode. Go to therapy.
Good. No one will listen, but good.
Maybe I should put it, don't go to therapy, and everybody might listen.
That's a good idea. Name it, don't go to therapy. People will be supportive.
So, all right. Well, thank you so much for coming on. I hope you enjoy the rest of your evening.
Thank you. You too. Always a pleasure.
All right. Bye-bye.